Sinai-Grace employees spread a little cheer at home and overseas. And don't let the flu bug take you down for the holidays. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. It's early in the holiday season, but Sinai-Grace Hospital employees are already in the giving spirit. Thanks to many wonderful donations, 86 goodie boxes are headed to U.S. military troops in Afghanistan, 36 more than planned. In just 2 weeks, employees collected things to read, non-perishable, and toiletries. The boxes will be sent during the holiday season. A little closer to home, Sinai-Grace Hospital employees are putting together holiday gift baskets for 50 local families. The great thing about any donation an employee makes, the hospital will match it to help make things even merrier for those needy families. The baskets will be handed out on December 16th. The last place you want to be for the holidays is home and in bed. It's not too late to get your seasonal flu shot. You can either contact your Sinai-Grace Primary Care Doctor or use the walk-in service at our Primary Care Center. Contact the Primary Care Center at 313-966-9444 for hours and information. Having aches and pains in your knees? Our Sinai-Grace orthopedic specialists have the remedy. Tina Taylor has more.
Knee pain is an extremely common complaint. In fact, it's the most common reason people see an orthopedic surgeon. And while there are many causes of knee pain, all too often we just assume joint pain is a normal part of aging and that we just have to learn to live with it. But doctors say there are a wealth of treatment options, from exercise and medications to joint replacement surgery, all that help relieve pain and get you back to doing the things you love to do.
Pain in the knee can be simple, it can be complex. It's based on duration. If it's a short duration, a lot of times it goes away on its own. If it's from a small accident like a bump or a bruise, usually it's going to go away. Where you have to be concerned is if it becomes chronic or long lasting, it doesn't go away. A simple aspirin or Motrin doesn't take care of it, or if it's severe in nature. In younger people, I see a lot of ligamentous injuries, some cartilage injuries. A meniscus injury is very common, which is a type of cartilage in the knee. In the older population, I see a lot of arthritis, inflammation of the knee. When somebody presents with arthritis in the knee, we start simply with medications, anti-inflammatories, which are often enough. If that doesn't work, we try physical therapy and an exercise program. Weight loss helps. From there, to treat arthritis, we jump up to injections such as steroids or a cartilage gel type of injection.
If medications, changing your activity level, and using walking supports are no longer helpful, you may want to consider total knee replacement surgery. Resurfacing the damaged and worn surfaces of the knee can help relieve pain and help people resume normal activities.
We have a total joint program here at Sinai-Grace Hospital. We specialize in knees and hips. For the knees, we do a minimally invasive type of knee replacement. This gives you a smaller incision. It gives you quicker rehab, quicker recovery. We have a private floor with private rooms with dedicated nursing. Expectations after a knee replacement initially are about 2 days in the hospital. We get you out of bed and walking the first day with a therapist and a walker. We progress from a walker to a cane, usually within about 2 weeks. The hospital stay is 2 days, so you either go to home or to rehab. If you're home, therapy will come to your house. If you go to rehab, you have therapy every day. Most people are off the walker and walking with the cane within 2 weeks, sometimes sooner, and most people are off a cane within 6 weeks. Yeah, the 2 weeks is typical, but there's always people that recover slower. There's always people that recover faster. I had an 80-year-old gentleman, I did both knees on him the same day. He was walking with a cane in 2 days and with no cane in 3 days. That's not typical, but he amazed everybody. We can't do 2 knees at the same time. There's factors we consider: the patient's age, the patient's health, the complexity of the deformity, if there is one with the arthritis. There's new technology. The materials are better designed and to last longer. Mainly the artificial bearing surface lasts longer. The components are shaped more anatomic, so they fit better in the body. The cement is a better mixture, so it bonds better. My theory is if you're in pain, nothing works. and you need a knee replacement, you should have a knee replacement. It doesn't matter how old you are. If you need one, you need one. And they do last longer nowadays, and we have techniques to, when they do wear out, give you a new knee, a replacement new knee. We have an established program here. Patients do very well here. They're happy with the care they receive here, with the nursing, and with their outcomes.
Regardless of the type of surgery used to treat your knee pain, pain management with medication, specific exercise, and physical therapy will have you on the road to a relatively quick recovery. And that's great news for the millions of people living with knee pain. For a Sinai-Grace orthopedic specialist, call 313-966-4800. I'm Tina Taylor for Sinai-Grace Today.
Is it true that warm milk will make you sleepy?
Is it true that warm milk will make you sleepy? Well, we know that milk contains an amino acid called tryptophan, and the body uses that tryptophan to make serotonin, which is known to promote sleep. So for the longest time, people believed that drinking milk actually helps you fall asleep sooner. But studies have really been inconclusive. They've gone sort of both ways. So does milk help you fall asleep sooner? Is again plausible, but not necessarily true for everybody.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.